Ever wake up and your jaw just aches? Or maybe a dull headache?
Oh,
Or your teeth, they just feel, well, weirdly tender. You might not even realize it. But that unconscious clenching or grinding,
wow.
millions of people do it. And maybe, just maybe, it's your body trying to tell you something really important.
Mhm.
This habit, this involuntary thing, it actually has a name. Bruxism.
Right, right.
And it can happen when you're wide awake. That's awake bruxism. Or, and this is more common, when you're totally asleep. Sleep bruxism. So in this deep dive, our mission is basically to decode this hidden signal. We're going to explore, why it happens, how doctors figure it out, and crucially, what you can actually do about it. And honestly, the range of causes and what it implies, it's much more complex than just thinking, oh, stress.
It really is. What's so fascinating, I think, is just how multifactorial it is. I mean, it looks like simple teeth grinding on the surface,
Yeah.
right? But the origins, they can be incredibly diverse. We're talking psychological stuff, underlying medical conditions. It's a whole mix. And as we'll get into, this isn't just a human thing. We actually see similar issues showing up as bruxism in animals, especially horses, which gives us this broader kind of universal perspective.
Absolutely. So yeah, let's jump in. We're going to unpack this whole complex topic, give you a shortcut to being really well informed, and maybe share some surprising facts along the way. Okay, so that clenching, the grinding, where do we even start looking for the why? I think most people, their first thought is stress.
Right. And that's not wrong.
Yeah, there's definitely a strong link there, isn't there, between like psychological, emotional factors and bruxism, especially the awake kind.
Definitely.
High stress, anxiety, feeling tense, angry, frustrated. Those are huge triggers. Some research even points to personality types, more aggressive, competitive, maybe hyperactive people being more prone to it.
Mm.
And even just concentrating really hard, focusing on something at your desk. You might be clenching without even noticing.
That's spot on for awake bruxism. But then you shift to sleep bruxism, and the picture gets, well, even more complicated.
Mm.
And what's really key here is if you only think about stress, you're missing a huge part of the story, all these different potential causes.
Mm.
It means there's rarely just one easy fix.
Right.
Sleep bruxism, for instance, it's often tied to other sleep problems.
Like what?
Well, things like obstructive sleep apnea, OSA, where you stop breathing briefly during sleep. The bruxism might actually be like an exaggerated reaction, a motor response to these little micro-arousals that happen naturally during sleep.
Huh, okay.
We also see connections with GRI, acid reflux happening during sleep. That can trigger it. Even things like night terrors or sleepwalking.
So it's rarely just about the teeth themselves then. I mean, things like a bad bite malocclusion, right?
Yeah.
Or maybe recent dental work, that can contribute.
They can contribute, yeah, but they're actually seen as less of a primary cause these days than we used to think.
Interesting.
Exactly. And what else could be going on? Well, something really interesting is the influence of certain medications and other substances.
Oh, like what?
Well, some antidepressants, specifically SSRIs, drugs like fluoxetine, sertraline, bruxism can be a side effect.
Wow, okay.
And other psychiatric meds, too. Stimulants like those for ADHD, even illicit drugs. And then the common stuff, caffeine, alcohol, smoking, they can all kick it off or make it worse.
Goodness, the list just keeps going. And what about other medical issues?
Yep, those too. Neurological disorders can play a part. Parkinson's, dementia, epilepsy, Huntington's disease.
Mm-hmm.
Even ADHD, as you mentioned with the stimulants, is sometimes linked directly. It just adds layer upon layer, doesn't it?
It really does.
And one more thing, connecting this back, there seems to be a genetic link too. Sleep bruxism often runs in families.
Really?
Yeah, suggesting there might be some genetic predisposition that makes certain people more likely to develop it. So it's not just your environment or stress. It could be partly hardwired.
Okay, wow. So with all these possible causes, how on earth do you figure out if you actually have bruxism? Especially if it's happening while you're totally out of it, asleep.
Yeah.
It sounds really tricky to diagnose because most people have no idea they're doing it. Often it's like the dentist or maybe your partner who notices first, right?
Exactly. That's usually how it starts.
So how do they uncover it? What's the process?
Well, usually the first big step is a clinical exam by a dentist. They're looking for really specific signs inside your mouth, like teeth that are flattened, chipped, cracked, maybe even loose, or enamel that's worn down so much that the layer underneath, the dentin, is exposed. That causes sensitivity and pain.
Ouch.
Yeah. They'll also look for little indentations on your tongue or maybe raised tissue inside your cheek, signs that your teeth are pressing or grinding there constantly.
Mm-hmm.
And it's not just the teeth. The dentist will feel your jaw muscles, the big ones,
Yeah.
masseter and temporalis, and the jaw joints, the TMJs.
Checking for tenderness.
Tenderness, stiffness, pain, yeah. And they'll check how well your jaw moves, listen for clicks or pops, all clues.
Makes sense. And I guess your own story matters too, right? What you tell the dentist.
Absolutely vital. That patient history and self-report piece is huge. The dentist will ask about symptoms. You're having headaches, jaw pain, tooth sensitivity, feeling tired. And when they happen,
Right.
they'll ask about stress, lifestyle stuff like caffeine, smoking, alcohol, any medications you're on, your sleep habits.
And crucially, whether your partner has mentioned hearing grinding noises.
Exactly. That's often a key piece of evidence, especially for sleep bruxism. And for sleep bruxism, if they need a definitive answer, the gold standard is polysomnography, basically a sleep study.
Okay, what does that involve?
Well, they hook you up to sensors that monitor all sorts of things while you sleep. Brain activity, heart rate, breathing, and especially muscle activity in your jaw using EMG, electromyography.
Ah, so they can actually see the muscle firing?
Precisely. Plus audio and video recordings to catch any grinding sounds or movements, and also to rule out other things like sleep apnea. And for awake bruxism, there's something relatively new called ecological momentary assessment, or EA.
EMA.
Yeah, it often involves using apps or maybe wearable sensors to track your jaw muscle activity in real time throughout your day. It helps pinpoint patterns and triggers you might not even be conscious of.
That's clever.
Hmm.
Okay, so once it's actually identified, what are the goals? What are we trying to achieve with treatment?
Broadly speaking, the goals are pretty clear. Reduce the grinding and clenching, ease the symptoms like pain and headaches, and definitely prevent any more damage to the teeth and jaw.
Right. So we found the signal. How do we actually turn down the volume on it?
Well, starting with dental approaches, those custom-made oral appliances, night guards, splints, people call them different things, they're really a cornerstone of treatment.
Okay. How do they work?
So a dentist makes one specifically for you, fits perfectly over your upper or lower teeth. Now, it's important to get this. They don't actually stop you from grinding.
Oh, they don't.
No, but what they do is protect your teeth from wearing down and getting damaged.
Huh.
They act like a cushion, absorb those huge forces when you clench, and that can really reduce the strain on your jaw muscles too.
So damage control, basically.
Exactly. Mostly worn at night for sleep bruxism, but sometimes people use them during the day if they catch themselves clenching a lot while awake. And, in some cases, if there's a really obvious bite problem that seems to be the main driver, maybe some dental adjustments or fixing damaged teeth might be part of the plan too.
Okay. And beyond the dentist's office, what about lifestyle changes, behavioral stuff, especially if stress is a big part of it?
Hugely important. Stress management is key. Things like counseling or therapy, CBT, cognitive behavioral therapy can be really effective. Relaxation techniques to deep breathing, meditation, yoga. Some people find biofeedback helpful, where you actually learn to consciously control those jaw muscles.
Interesting. And for that awake bruxism, you mentioned just becoming aware of it.
Yes, awareness and habit reversal. Just
Yeah.
noticing when you clench and then consciously doing something different, like resting your tongue between your teeth gently. It sounds simple, but it can make a big difference.
And what about sleep itself? Improving sleep?
Oh, definitely vital for sleep bruxism. Good sleep hygiene, regular bedtime, comfy dark room, avoiding caffeine and alcohol and screens too close to bed. All the standard advice, but it really matters here. Also, maybe easing up on chewing gum all day or eating super hard. Chewy foods can give those jaw muscles a break.
Right. Makes sense. Now, with all these behavioral strategies, do medications ever come into play? And I feel like I've heard about some more surprising treatments for really stubborn cases, like Botox. Is that a thing?
Yeah, medications are usually more for short-term help, easing the symptoms. Sometimes muscle relaxants might be prescribed briefly to reduce that muscle tension in the jaw.
Yeah.
And yes, Botox. It has become a pretty significant option, especially for severe cases that haven't responded well to other things.
How does that work for grinding?
Well, it's injected directly into those main chewing muscles, the masseter and temporalis. It doesn't paralyze them, but it temporarily weakens them just enough to reduce the force of the clenching and grinding.
Huh. How long does that last?
The effects usually last about 3 to 6 months, so it needs repeating.
Huh.
And beyond that, if the bruxism seems to be a side effect of another medication, the doctor might look at adjusting the dose or trying a different drug. And of course, treating any underlying medical stuff like getting GERD or sleep apnea under control that can often make the bruxism itself much better because you're tackling the root cause.
It really highlights why getting to that root cause is so important, because if you don't address it, if bruxism just continues unchecked, it can cause some pretty serious problems, can it?
Oh, absolutely. Long-term complications are a real concern.
We're talking serious dental damage, right? Like teeth getting flat and worn right down.
Yep. Worn down chewing surfaces, fractures, chips, especially in the back teeth, the molars. Increased tooth sensitivity is common too, because that protective enamel wears away, exposing the dentin underneath. It can even lead to loose teeth or make gum problems worse.
And the pain isn't just in the teeth, is it?
Not at all. Jaw and facial pain are very common. Sore, tired jaw muscles, especially when you wake up. And it's a major contributor to TMJ disorders, temporomandibular joint disorders.
Right, TMD. That involves clicking, popping sounds in the jaw, pain.
Exactly. Pain, stiffness, clicking, popping. Sometimes the jaw might even lock temporarily. It can really limit how well you can open your mouth. And that pain can radiate. Tension-type headaches are very common, often starting around the temples or the back of the head. Even earaches. It feels like an ear problem, but it's actually referred pain from the jaw joint.
Wow.
Neck and shoulder pain, too, as all that muscle tension spreads.
And I imagine it can wreck your sleep, even if you're not aware you're doing it. And maybe your partner's sleep, too.
Definitely disrupts sleep quality. And yeah, the noise can certainly bother a sleep partner. In really severe, long-standing cases, you might even see the jaw muscles get visibly larger. That's muscle hypertrophy.
So bottom line, diagnosing it early and getting a comprehensive management plan is really crucial.
Absolutely. It prevents those long-term issues and just makes life better.
Okay, so we've really dug into the human side of this signal. But you mentioned earlier, this isn't just a human thing. Animals get this too.
That's right. And looking at animals, especially horses, gives us a really fascinating comparison.
How so?
Well, in animals, bruxism is also that rhythmic, non-functional grinding or clenching. But here's a key difference, or maybe emphasis. In animals like horses, it's very often seen as a pretty direct sign of discomfort or pain.
Ah, okay.
Or sometimes it points towards a neurological issue. It's less likely to be just stress in the human sense, and more often linked to a specific underlying physical problem, which actually ties back nicely to some of the human causes like GERD or other medical conditions.
Right. So similar connections. Like, I think I read that in young horses, foals, bruxism is often linked to stomach issues, ulcers, gastritis, problems with acid reflux.
Exactly. Gastroduodenal ulceration, gastritis, esophagitis, those are common culprits in foals. They get issues with their stomach emptying properly, leading to reflux that irritates the esophagus. Strong parallel to human GERD triggering bruxism.
And in adult horses, what triggers it there?
Often related to pain in the throat or esophagus area. Sometimes irritation from having a tube pass through their nose into their stomach, like a nasogastric tube, can trigger it. But really, like you said about ulcers, it can happen in response to almost any painful condition in a horse. Gastric ulcers are a really big one.
Interesting. And are there environmental factors for horses too, like not just internal pain?
Yes, definitely. Things like poorly fitting tack saddles, bridles, or really intense, stressful training methods have been implicated. And sometimes, kind of like a bad habit, it might become what they call a vice in horses, happening without a clear trigger, maybe linked to certain management routines or training stress.
And the neurological link, you mentioned that in humans too.
Yep, same in horses. It's associated with certain neurological diseases like Borna disease or even rabies. There's thought to be a strong link to disruptions in brain chemicals, neurotransmitters, especially the dopamine system.
What are the signs you might see in a horse, besides the grinding?
Sometimes it's subtle, maybe mild difficulty swallowing, what we call dysphagia, excess elevation, maybe they're off their food a bit, or shows signs of mild colic, which is like abdominal pain.
So how do vets figure it out and treat it in horses? Is it similar to humans?
Well, diagnosis often involves using an endoscope, a camera to look inside the throat, esophagus, and stomach. That helps figure out if there's inflammation, ulcers, or injury that's causing the grinding.
Makes sense.
And treatment. Crucially, in animals, it's all about treating the primary problem. Find the ulcer, treat the ulcer. Find the sorts of pain, manage the pain.
So fix the underlying issue, and the bruxism should resolve.
That's the goal. The bruxism itself can cause sore muscles in the horse, sure, but the main complications usually come from whatever disease was causing the grinding in the first place. So treatment might involve pain relief like NSAIDs, or ulcer meds like omeprazole, or things to protect the stomach lining.
Wow. Okay, so pulling this all together, human bruxism, horse bruxism, what's the big takeaway here?
I think what's really profound, what stands out, is that bruxism, whether it's happening in you or in a horse, is fundamentally a signal.
Right.
It's this physical thing the body does, often involuntarily, that points to something else going on underneath. Psychological stress, maybe a sleep disorder, maybe physical pain, maybe a neurological thing.
That really is the aha moment, isn't it? It's not just about the teeth grinding away. It's like this loud, involuntary alarm bell from the body saying, hey, look deeper, something needs attention.
Hmm.
Like a physical cry for help. What an incredible deep dive this has been. We started with that involuntary clench and grind in us humans and uncovered this whole web of causes stress, sleep issues, meds, even our genes. Then we took that surprising leap, looking at horses, and saw how that same kind of grinding often signals pain or neurological problems there too. It's fascinating.
It really is. I think this journey has shown us just how powerful bruxism is as an involuntary signal from the body. It's this clue telling us something deeper might be going on. Could be stress, could be sleep, could be physical pain. It really highlights how connected our physical and mental states are, and not just for us, but for the animals around us too. It feels like this sort of universal language of discomfort.
It really does. So it leaves you wondering, doesn't it? What other invisible signals might your own body be sending you right now? Or what signals might you be seeing in the behavior of animals you know? And maybe, just maybe, if we become more attuned to these subtle cues, these physical whispers, could that help us uncover and address deeper issues about well-being? Not just for ourselves, but maybe for all the creatures we share this planet with. Makes you think.